Semester 2 Otolaryngology Unit 3 important questions. Explain the various disorders affecting the oral cavity. Explain the various tumors affecting the oral cavity. So diseases and tumors. Describe in detail the cleft lip. Describe in detail the cleft palate which is possible on the roof of the oral cavity. Cleft palate. This is the upper lip mainly. The cleft in the upper lip either in the center, median cleft lip or on the lateral aspect. Just below the nostrils. That's called lateral cleft lip. If it is on one side, we call it as unilateral. If it is on both sides, we call it as bilateral. Discuss the anatomy of the pharynx. It is basically the nasopharynx, oropharynx and laryngopharynx. Inside of that, few structures will open that you should be able to explain. Describe the mechanism of swallowing, the oral phase, pharyngeal phase and the esophageal phase. First phase is voluntary, the next two phases are involuntary. Those phases, how the food is prevented from coming back into the oral cavity, going up, coming back into the oral cavity is by the tongue, going up into the nasopharynx is by the soft palate, so it has to go backwards. So all this you should be able to explain. Describe in detail the pharyngitis, acute or chronic pharyngitis, which you should be able to explain. So inflammation of the pharynx is called as pharyngitis. You should be able to explain the pharyngitis. Within the lateral wall of oropharynx, we have something called palatine tonsil. The inflammation of the palatine tonsil, we call it as tonsillitis. So if it is acute tonsillitis, we give antibiotic for the infection, bacterial infection, analgesics for relief of the pain, antipyretics if at all there is fever, local therapy, okay, gargle, salt water gargle or betadine gargle. If it is chronic tonsillitis, then we have to remove the tonsils, and that is called tonsillectomy. So that you have to write. What is adenoids? In the nasopharyngeal tonsil, in the roof and the posterior wall of the nasopharynx, there is tonsil that is called as nasopharyngeal tonsil. Inflammation of the tonsil is called as adenoids. Here there is a nasal blockade and the person will have pinched up nostrils, deformed tooths, slap cheek. So all this is called adenoid phases. So you should be able to write about the adenoid phases, especially the pediatric child. Treatment is mainly removal of the adenoids. Adenoidectomy you should be able to write. Explain in detail the tumors of the pharynx, especially nasopharyngeal carcinoma occurring in elderly, smokers and hookah and all. If they are able to smoke by their nostrils, so they will end up in nasopharyngeal carcinoma. Oropharyngeal cancer can also happen in the posterior part of the tongue and the pharyngeal wall. So you should be able to explain the carcinomas of the pharynx. Moving on to the unit 4. Unit 4, we have the questions related to the larynx. Describe in detail the clinical anatomy of larynx. Explain the differences between the adult and infant larynx. I have made a detailed video on this. Please see this difference between adult and infant larynx. On clinical examination of the larynx, how do you examine the larynx clinically? So you should be able to explain it in detail. And what is stroboscopy? One video camera will be there with one connected to one device screen. So we should be able to do the technique. We will be able to see the vocal cord moving delicately, the mucous membrane of the vocal cord. So that is called stroboscopy. The technique, procedure and interpretation of the stroboscopy. Describing in detail laryngitis, acute and chronic laryngitis. Inflammation of the larynx is called as laryngitis. That one. Explain in detail vocal nodules. The free margin of the vocal cord can develop a nodule because of vocal abuse, excessive use of voice. So it is called vocal nodule. Especially it happens for teachers and singers who abuse their voice. Explain in detail the benign tumors of the larynx, which are usually polyps, and malignant tumors of larynx is usually laryngeal carcinoma, especially in smokers. So you should be able to explain in detail the location, whether it is supraglottic, glottic or infraglottic carcinoma. This one also videos are there. Please see that and understand. Describe in detail laryngectomy, a procedure in which the larynx is removed and artificial larynx is given to the patient. That is laryngectomy is the procedure. What is phonosurgery? Similar surgery concerned with the larynx. Artificial larynx is implanted and given the phonosurgery. So the person is able to use, instead of a natural larynx, the artificial larynx. And the last topic is unit 5 questions. It's very simple actually. Esophagus, clinical anatomy and physiology of esophagus, especially the anatomical part, the length of the esophagus 25 centimeters, the constrictions of esophagus, and then the blood supply of esophagus, the wall of the esophagus consisting of mucosa, submucosa, muscular section and serosa. That much is good enough. Any anomaly of esophagus, including tracheoesophageal fistula, that itself can be asked as a separate question. Esophageal fistula, any abnormal connection of the esophagus with the exterior or with the tubes which are there interior. That abnormal tract is called fistula, and the condition is called esophageal fistula. Various types are there: H type, L type, T type of tracheoesophageal fistula, connection between airway and the foodway, food passage. Tracheoesophageal fistula. Inflammation of the esophagus is called esophagitis. This occurs especially in case of those who are obese and because of the gastric acid reflux, or some person who has consumed some poison, some acid agents they have drank, and that has caused erosion or the tear within the esophagus, resulting in esophagitis. Describe in detail the benign tumors of esophagus, again the polyps and the myomas. And malignant tumors of esophagus is esophageal carcinoma, again alcohol and smoking is to be blamed. Squamous cell carcinoma of the lower end of the esophagus is common. Also in case of reflux disease, gastroesophageal reflux disease, because the acid will spurt into the esophagus, resulting in a tumor, malignant tumor. Explain in detail various airway management procedure in which the airway can be managed. Okay, it can be a simple opening of the airway, pulling the tongue forward, or it can be a mouth to nose ventilation or mouth to mouth breathing, or ambu bag ventilation, or endotracheal intubation. Various procedures are there. We'll try to do a video on this and post it soon. Okay. Thank you for watching and learning from Logic Medico. Bye. Kindly subscribe, press the bell icon and thumbs up icon if you like this. Thank you.